All right, this is the humerus. To know left from right, you first have to find the dog paws. So if you put it down like this, you see how dog paws poke out? This side does not work. So if you see the dog paws when looking down at it, you know this is going to be the anterior side. Once you find anterior, well, you need to find the head of the humerus. So this is anterior because you see dog paws, and you see the head of the humerus. So it has to be going inwards. So this is going to be your left. This is going to be your left humerus, all right? Because the dog paws are anterior. This has to be going into the body, like that. Okay. All right. For the bone markings, since this is now the right humerus, hold this, right there, yeah, right humerus. You have the head of the humerus, right here. Then you have the surgical neck, which cuts along right around here. Then you have the anatomical neck. You have the greater tubercle and lesser tubercle. You can see that this one's larger and it's even on top. This is less. This right here is your intertubercular sulcus. And then going along the side, you have this roughened surface, this roughened projection right here, and you can feel it on the other bone. This roughened projection is called the deltoid tuberosity. This is where the deltoid muscle rolls over and attaches right there. And it's roughened because the deltoid muscle pulls on it constantly. Going down along the side, you have this little outside ridge. This is going to be your medial epicondyle. And conversely, you have the lateral epicondyle, which you can only see posteriorly, which is right here. So flipping it back, we have two ridges that branch off along the side. This is your medial supracondylar ridge, and this is your lateral supracondylar ridge. And if you rub your finger over it, you can feel how it ridges out. There are two fossa on the front. This first little fossa is going to be your coronoid fossa, and then you have this other fossa right here, which is your radial fossa, which makes sense because the radius, the head of the radius attaches right here at the capitulum, which means small rounded projection. Then you have the trochlea right here, which is where the ulna wraps along right there and runs up along the side of it. So you have the coronoid fossa and the radial fossa with the trochlea and then the capitulum. And then on the posterior side, you have this huge, huge fossa right there. And that's going to be your olecranon fossa, where the olecranon process attaches. And again, the trochlea runs along the back side from the front side. So you have your lateral epicondyle, medial epicondyle, trochlea, olecranon process, or fossa. And that's it for the humerus.